What about younger people? So we do tend to think of cancer as something that affects older people, and it is more prevalent in older people, but saying people under the age of 35, are there specific signs and symptoms that people who are younger should be looking out for?
Yeah, it's not a straightforward answer, Zoe, unfortunately. Some of the symptoms that happen in younger adults are really generalised and quite vague. You know, things like persistent tiredness, for example, or loss of appetite, unexpected weight loss when you're not even trying to. And that's made more complex because some cancers are actually more common in younger adults. You know, I think it comes down to the point that you just made, which is it's about understanding what's your version of normal, what's normal for how your body feels and looks, and becoming an expert in that so that if something doesn't feel quite right, then you know that it's time to speak to a professional.
Do you think younger people are less likely to come forward? And if so, why?
I think people can feel embarrassed about symptoms and they don't want to bother the doctor. And I think, you know, we should rest assured that that's what doctors are here for. It's our job. You know, we're here to help regardless of whether that's, you know, giving you some reassurance or, you know, checking out your symptoms and saying, actually, I think this is probably worth something that we need to investigate.
Maybe one of the, well, I hope anyway, one of the things that might help younger people is a general better awareness of our bodies, feeling more comfortable at exploring our bodies, you know, at looking at our poo, at using a mirror, you know, to look at our vulva, for example, which I know with my older patients, they can be quite squeamish about things like even looking at their poo. And I feel like that message hopefully is getting through to younger people. What would you say to people about that?
Yeah, I completely agree. You know, I think there used to be lots of advice about the best way to check for things and even, you know, recommending the best time to check for things. You know, I remember reading something in the media that women should be checking their breasts in the shower just before their period. Actually, I think it's probably more generalised than that. People just need to check in with themselves about exactly what's normal, what their poo looks like, you know, what the vulva looks like, and do that on a regular basis at different times of the month. That's particularly important for women on their periods because the body changes a lot, so that they can become aware of what changes look like and if they feel different.
It's really bizarre that we have these bodies, we own them, they're ours, we have to look after them, they're our responsibility, yet sometimes we feel more comfortable letting somebody else look at them or touch them in certain places, but you know, they're ours. So own them, people, look after them.